To begin, the construction formally started last Friday, June 25th. The on-site contractors regarding site clearance began clearing all of the underbrush of the property and ultimately will clear about 64 acres of the property. The clearing began right north of Route 6 and will continue to the lake property and around. That encompasses about 64 acres. Decision has been made and we have awarded 4 contractors the initial work regarding the project. The process in which we used to begin this began back in March of 2010. Obviously, looking at the quality of the bids, we used several local folks that helped us gauge the reputation of the bidding contractors, their work quality, and then also the pricing. Robbins & Morton is our general contractor. They did a great deal of this work. Then they provided local folks here within the health system final decision regarding the bids. For our site work, our earth removal work, that bid has been awarded to Dyer Construction out of Dyer, Indiana. They're the folks that are now on site clearing the property. Steel fabrication, that contract has been awarded to Cives Steel out of Wolcott, Indiana. They are going to use Chicago Decking Erectors, a group out of Merrillville, Indiana, to do the actual steel erection once the steel has been fabricated. And then the foundation and piers, the process in which that is completed, that is a very specialized, regionalized project. That contract has been awarded to Subsurface Contractors out of St. Louis. The piers we need will number roughly 200 piers to encompass our 430,000 square foot facility. So you can imagine the magnitude of the work that's being done for that. Once that work is complete, they are using another regional company, Skirto Cement out of Gilpertis, Illinois, to do the actual work on site. As it relates to the economic development that we've spoken so much about the last 2 years, and how do we use as many of these dollars to put folks in Northwest Indiana back to work, all of our subcontractors are using local folks to do the actual work on site at the 6 and 49 construction site. From a utility standpoint, we are moving forward with NIPSCO for gas and electric, and we are in the contracting phase with NIPSCO. Indian American Water will supply the water, and as it relates to sewer, our sewage provider is Damon Run Conservancy District. Within the next 30 days, the remainder of the underbrush, the trees will be cleared. Within the next 60 days, you will see a great deal of grading, filling in work to make sure the site is completely level and prepared for the foundation and the piers to be put in. The true fun part of the project, the concrete and the steel, will arrive within the next 3 months, and then you will see the true form and shape take place on 6 and 49. We are going to begin the construction of the work bids regarding other build out of the project in August. We will hold that pre-bid meeting with several local contractors from the area, much like we did with the first 4 contractors. That process will occur in August. We will then award those bids most likely in the fall, and you will begin to see that work occur most likely early next year, depending on the weather. As you know, Northwest Indiana weather can be tricky, and we're trying to use as much of the warm weather as possible to keep our project moving forward and meet the 2012 deadline for completion. On July 21st, I'm excited to announce that we'll have our official groundbreaking ceremony. It's not just building your replacement facility for Northwest Indiana, but an economic development project that we think can really spur the economy and move us out of the recession in Northwest Indiana. We're estimating roughly 600 construction jobs over the 2-year period. The community and our patients are looking for convenience as a factor to their health care. Obviously, 6 and 49 has been identified as one of the fastest growing corridors in Northwest Indiana, and we will be able to offer them the growth and development of a new hospital campus, and now the addition of a medical campus somewhere in Valparaiso. We're going to add a different campus so that we can continue to serve the Valparaiso residents in the same form and fashion that they've experienced so far on an outpatient basis when the new hospital does move north. Picture the lobby that you walked in today. A little smaller. It's, I don't know, maybe 14 feet tall. It's got some glass. Our new lobby will be 2.5 stories tall, all glass, natural light, seating for roughly 100 people, maybe 80 people. Registration booths to accommodate 24 people at a time. All private, HIPAA compliant, spacious. The ability for people to have one-stop registration and then move to a central core of elevators where we'll have 6 elevator cars that will take you anywhere in our facility. Everything that a patient needs will be literally footsteps away from the emergency department. When you need the care the quickest, we've really focused the efficiency for our staff to shave minutes off the care process because, as you know, minutes save lives.